Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Now we look at the asthma treatment. So under the asthma treatment, this is going to be part 2. In part 1, we have already discussed the short-acting beta-2 agonist, the long-acting beta-2 agonist, and the short-acting muscarinic antagonist, longer-acting muscarinic antagonist, and we have discussed the drugs and the uses and side effects. Now we will be continuing with the methylxanthines. So what is a methylxanthine? So this methylxanthine they are the drugs. It includes the aminophylline and the theophylline. And these drugs, it increases the IL-10 release. So increases the IL-10 release, and also the decreases the inflammatory gene. So it increases one thing and decreases one another. So it increases the IL-10 release and decreases the inflammatory genes. Now, what are the adverse effects and uses? The uses and adverse effects is there is aminophylline. Aminophylline is given via the IV route, and it is used to treat the acute attacks of asthma. And this treatment is given. So theophylline is used for the mild asthma as well, and also in cases of severe cases of the COPD, it is used. Then moving on to the inhaled steroids. Inhaled steroids is another category. It includes drugs such as the beclomethasone, then the budesonide, as well as the cyclosonide, and there is the fluticasone as well, and the flunisolide, and the mometasone. So the steroids, it works by stimulating the beta-2 response. So they work by stimulating the beta-2 response in the lungs, and as a result it increases the bronchodilation. So what are the uses and adverse effects of the inhaled steroids? The steroid inhalers are mainly used to treat the asthma and also the COPD, as we discussed. So what are the oral steroids? The oral steroids it includes drugs such as the prednisolone and also the methylprednisolone. So what are the uses and adverse effects is that there is oral steroids are used in case of the persistent severe asthma. To learn and grow daily like this, please do subscribe.